Now I'd like to introduce our first speaker, Dr. Michelle Cretella, Executive Director of the American College of Pediatricians. Dr. Cretella is an expert on the issue of transgenderism, especially as it presents among children. We are honored by your participation with us today. Dr. Cretella will present Transgender Belief, a call to heal minds and save lives. You're on, Dr. Cretella.
Thank
Hello,
you.
good morning.
Hello.
How are you today?
Fine.
Good.
Happy to be here.
Oh, I'm happy to see you at last. All those emails back and forth. We are kind of like live with each other today. Welcome. Well, I want to move forward straight into your presentation, Dr. Cretella, so let me leave you to that.
Okay.
Thank you.
Very good. Thank you. First, I want to let the audience know that Jacqueline does have a copy of my slides that she can share with all of you by email. So I do apologize. Some of the slides are a little busy, but you would be able to receive them in your email to be able to take a closer look at your leisure. So the gender issue, I am who am. My presentation here, I want to open picking up on some of the bishop's comments about the importance of speaking truth in love. And here on my first slide, these are images of all young women who once were very deeply believed that they were trapped in the wrong body. To the far left is a young woman named Laura Perry. She is Christian, and she spent several years taking testosterone as well as going through surgeries to appear to be a man. She eventually came back to her Christian faith and reconciled with her family, and is now a very ardent Christian woman who has a ministry to those who, like her, struggle with accepting their biological sex. In the center is an image of a young woman named Kira Bell. She is from the UK, and she transitioned by taking testosterone and having a double mastectomy between the ages of 16 and 19. And at the age of 23, now, very recently, just a few months ago, she successfully sued the Tavistock Gender Clinic because by age 21, 22, she realized they lied to her, that no one can change their sex, that she was a woman, born female, will always be female, and as a result of the testosterone and the surgery, she is terribly harmed. She sued the clinic in the UK, and the UK government has sided with her and her team. And in the UK, teenagers are no longer allowed to receive hormone therapy or surgeries. It is reserved for adults only. To the far right of the screen, these are four young women who are of the liberal. They're very liberal in their views, and I include them because it's important to understand that this issue is a scientific issue that transcends left versus right, liberal versus conservative. So the four young women pictured to the far right, they are in their mid-20s now, each of them in their mid-teens, around roughly age 15, 16, they were presenting as male. All but one actually had gone on testosterone, and some also had double mastectomies. By the time they reached their early 20s, they realized the irreparable harm, which I'll go through in the rest of my presentation with you. But there is a very large population, growing population of young men and women who were given these hormones and surgeries as teenagers who are now realizing the truth that you cannot change sex, and they are physically and emotionally devastated by the irreversible changes. So we talk about, they call it gender incongruence or transgender or gender dysphoria. So what I want to review in this presentation are some basic definitions, what the so-called gender experts are saying to us, what the so-called sex change interventions are being done on kids. And then I want to look at what causes this belief in children, and then finally answer the question, can counseling alone work? And Bishop got into this a little bit earlier, is that, there was a time when everyone understood sex and gender as synonyms. And they understood that sex is defined according to the role in reproduction. It's determined by our genetics at fertilization. And there are only two choices: males. So whether it's a male human being or a male animal or a male plant, the male donates genetic material to produce the baby. And the female, whether it's a female plant, animal, or human, the female receives genetic information to produce the baby. And the female also carries and gives birth to the baby in the case of mammals and humans. Sex is genetic and it's present at fertilization. It is an inborn trait. And because it is genetic, established at fertilization, it is unchangeable throughout a person's life. There are no drugs and no surgeries that can change sex. Uh-oh. So my clicker worked for the first one. Oh, there we go. We are often asked, well, wait a minute, how can you say there are only two sexes? What about people with intersex conditions? And that is a very important distinction to make. We have people are male or female, and just as we have people who can have birth defects that affect the face or any other organ system in the body, we also have males or females who have birth defects that affect the reproductive organs and or the external genitalia. So intersex conditions are medical disorders. They're not new sexes. They are, and I'm not minimizing it. I understand these can be very tragic, but they are treatable. Fortunately, they are rare. And we know that these are disorders because every one of these intersex conditions is associated with reduced fertility, impaired fertility. And those with intersex conditions are entirely separate from people who have a transgender belief. So two entirely separate categories. As Bishop alluded to, at the UN in the 1990s, policymaking wise, politically wise, gender and sex were separated, and gender was used more to mean like masculine versus feminine. It's rooted in sex stereotypes, culturally defined, not determined by genetics. So what we are seeing now, we're seeing girls who maybe have more masculine interests. They like rough and tumble play, sports. And instead of culture or society recognizing them as, well, these are girls who just like sports and maybe stereotypically male pursuits, these girls are getting labeled as trapped in the wrong body. And similarly, boys who may have more feminine interest, break the typical, they don't like the typical rough and tumble play. They're not very good at sports. They show more of an interest maybe in music, art, cooking, rather than recognizing them as boys of value who have different interests. They are being labeled as boys trapped in the wrong body. Oh, I guess this will teach me to. And transgender is the term that has been given to people who feel emotional distress when they think about identifying with their biological sex. And as Bishop alluded to, we've come up, thanks to queer theory and gender theory, there are over 100 different labels or genders available to our young people who access the internet. But none of those genders are biological. So what we are told by physicians and counselors who identify themselves as gender experts, we are told some children are just born with the wrong brain. There is no link to mental illness. They say that counseling is just useless and harmful. And what really frightens parents is that parents are told, unless you affirm your child as the opposite sex, your child will kill themselves. Now, we're going to go through not one of these is correct. Not one of these is true. And I will bring audiences to a disorder that many are familiar with, eating disorders. So if we, no one has ever said, oh my goodness, anorexic girls, they're just born with fat brains trapped in their skinny bodies. Yet, the scientific literature has found tremendous differences between the brains of anorexic girls as compared to the brains of non-anorexic girls. Yet no one says that the difference in brain appearance means they were born that way. No one says that. When we're looking at the transgender brain studies, these brain studies are far fewer, very low quality, and they don't replicate one another. But we hear all the time, oh, it's a girl brain trapped in a boy's body. Or we're told, oh, well, these brain studies, well, no, maybe it's not an opposite sex brain trapped in the wrong body. But you know what? Everyone's born with a transgender brain. And for some, it just sorts its way out. So what is really going on? What's really going on is that the brain is like a muscle, and the appearance of the brain will change depending upon our relationships, our thinking, and our behavior. From conception, from fertilization, female brains and male brains are different. And they are different from fertilization because female unborn infants lack the male genetics. Female unborn infants also, because of genetics, do not develop the male testes. Those two facts, the fact that females do not have the male genes present at fertilization, nor do they develop male testes, is why a female baby is never born with a male brain, and the opposite is also true. A male unborn baby from fertilization has male genes present. From 8 weeks gestation, that male unborn baby develops testes and produces his own testosterone. So every boy who is born live has a male brain. The brain acts like a muscle, and it has a term. That term is called neuroplasticity. Neuro for neurons, which is brain cells. Plasticity means the capacity to change. So maternal infant gaze, the behavior, relationships between the baby and the mother, between the young child and his family, her peers, thinking, relationships, all of this will alter brain structure and function. So we expect to see changes when we look at the brains of one group of people compared to another. How about the genetic studies? Well, even here, if we look at studies of twins, we find in the case of eating disorders, identical twins will both have anorexia between 40 to 70% of the time. That tells us that there is a strong influence of genes, right? Genes never determine behavior or an emotion, but they can influence. So there's a very strong influence in eating disorders. There's a strong influence of genetics. The influence for transgender belief, however, is only 28%. And again, with eating disorders, we are never told, oh, anorexia, bulimia, those kids were born with it. There's no hope for them. We are never told that because it's not true. There is hope. Genes do not determine behavior. I mean, that's speak about truth and love. I mean, there's tremendous hope. We know that there's tremendous hope. As tragic and awful as eating disorders are, there is hope. We can help. Likewise, if we're looking at the science, we should be very encouraged with transgender belief because the genetic influence for transgender belief is much less compared to eating disorders. So what does shape behavior? And this is true of any behavior, not just transgender belief. Social reinforcement, right? What happens in our family, what happens in our schools, what we see on TV, what we read in papers and books on the internet, social reinforcement drives a behavior. We also know with in a case of transgender belief, psychologists like Dr. Kenneth Zucker and Susan Bradley had for 35 years, they were at the top of, they were known internationally as the top experts for treating gender confusion in youth. And they did identify patterns of increased mental illness in some of the families, as well as they identified certain family dynamics, not necessarily abuse, but just family dynamics that were misunderstood or misperceived by the child and led to the transgender belief. Sadly, child abuse is a factor for some children suffering from transgender belief, particularly sexual abuse. And this is because a child who is physically, emotionally, and or sexually abused may come to believe that their body, their biological sex, makes them unlovable or unsafe. Similarly, we have many, many studies now that link very high rates of severe psychological illness in teenagers that predate their gender confusion. So examples include severe depression, severe anxiety, even psychosis in some cases, bipolar disorder. Other teenagers or young children who develop transgender belief fall on the autism spectrum, may struggle with oppositional defiant disorder or ADHD. If these underlying disorders are successfully treated and addressed, the gender confusion may resolve. And finally, our behavior is also influenced by free will choices that we make. So, for example, children who or teenagers who spend hours on end on the internet binging on LGBTQ forums and websites are going to obviously be influenced by the ideas expressed there. We also know that there are actually adult transgender identified adults who are actively recruiting troubled teenagers to identify as trans. And there's also a link with pornography. Teens who get hooked on pornography are more likely to struggle with their sexuality and gender identification. The American Academy of Pediatrics and other gender experts across Europe recommend that even if a child is as young as 18 months old, and at 18 months, the child is perhaps just learning their first words, but they actually insist that a child as young as 18 months can know that they are trapped in the wrong body. And these gender experts recommend that parents socially transition them. That means start dressing your child and referring to your child as the opposite sex. When your child gets to age 8 years old, we should block their puberty with drugs. And sometime between age 8 and 16, we're going to give your child what amounts to essentially wrong sex hormones. And then under age 18, in America, as young as age 13, girls are being referred for double mastectomies, and as young as age 16, girls are being referred for hysterectomies. In America, as young as age 16, 17, boys are being referred to for surgical castration and or a penis removal. And an independent psychologist fact-checked the American Academy's report and found that every supposed scientific reference they said supported offering this to kids actually does not. In fact, what we know, there are several studies that show when you do put young children on puberty blocking drugs, almost 100% of them will then identify as transgender during their early teen years. So this process, this advice to socially transition, to use the puberty blockers, and then the wrong sex hormones locks children into a transgender belief. Puberty is not a disease. We should not be blocking normal puberty in physically healthy children. Stealing puberty, that's what puberty blockers do. Stealing puberty robs children of the developmental stage during which many of them will be cured. Prior to the transgender activism, as many as 98% of gender confused boys and as many as 88% of gender confused girls would outgrow their gender confusion by young adulthood. But now that we have our poor children they're surrounded by transgender activism from preschool all the way through grad school, on the internet, TV, everywhere, it's difficult for them to merely outgrow it. The gender experts often claim that the Endocrine Society and the American Medical Association, just like the American Academy of Pediatrics, supports drugs and surgery for these kids. And yet, when you read the fine print, you will see that the Endocrine Society itself admits that these drugs and surgeries are based on very low to low evidence. The only advice that is based on moderate to strong evidence is their advice that you must monitor these children very closely for harm from the drugs. What do puberty blockers do? Puberty blockers freeze the sexual development of boys and girls. They freeze them at a very early stage of pubertal development, but they do more than that. In little girls who are put on puberty blockers, you're basically putting these little girls into menopause. So sure, their normal breast development is blocked. When they become young adults, their sexual function will be abnormal. While the girls are on the puberty blockers, they are infertile. If these girls are put on puberty blockers plus the testosterone, they will be sterilized. The puberty blockers alone disrupt normal bone development. And the girls will never have normal bone density. That means, now, if you think about osteoporosis or brittle bones, we usually think of older women having brittle bones. But if you give the puberty blockers to the children, they can have brittle bones in their 20s. We also, with the puberty blockers, disrupt normal brain development. And there's the possibility of memory loss and low IQ. In the boys, they too, obviously their sexual development is stunted. They do not develop sperm. If they take the puberty blockers and then have estrogen added, these boys will be sterilized. The boys too will develop weak bones, memory loss, potential memory loss, and low IQ. Puberty blockers are not safe for kids. Sorry. We also know that puberty blockers worsen emotional distress. The package insert, Lupron, is the most common puberty blocker used in America in the US. So the package insert warns the doctors and the patients to expect mood changes, nervousness, anxiety, agitation, and warns doctors to watch for the development of worsening or new psychiatric symptoms. And this was also observed in the UK. The Tavistock Clinic actually recorded evidence that the girls who were on puberty blockers had worse behavioral and emotional problems and greater dissatisfaction with their body, greater self-harm. But the clinic hid that evidence. That's one of the reasons that Kira Bell was able to win her case. This all came out. This deceit came out. So even though puberty blockers can be stopped and a child's hormones will eventually kick back in, it's important to understand that temporary use of a puberty blocker can still cause permanent damage because normal developmental time is forever lost. Normal bone density is lost. Psychosocial milestones lost. The normal organization of the brain, the normal sex steroid organization of the brain is impaired. We don't have time machines. We can never give these kids back the normal development that was stolen from them by the puberty blockers. As I said earlier, the kids in the past, the vast majority without social indoctrination, without drugs or surgeries, most of the kids with gender confusion got better by young adulthood. That means they were not killing themselves. How about the risks of estrogen when that's given to boys and the risks of testosterone when given to girls? What this chart reflects, I'll just summarize. In both cases, both boys and girls will face an increased risk of strokes, heart attacks, diabetes across their lifetime, high blood pressure, and various cancers. What is unique to the girls who are given testosterone, even if the girls stop the testosterone, they will be left with a 5 o'clock shadow. So, facial hair. They will always have to shave. Their Adam's apple will be permanently enlarged, and their voice will be permanently low. So those young women who I had on my first slide, all of those young women who took testosterone as teenagers, despite identifying with reality in their 20s and stopping their testosterone, they still have a 5 o'clock shadow every night, a deep voice, and a large Adam's apple. And this is very traumatizing for them. On the male side, the males develop enlarged breast tissue and a female fat distribution from the estrogen, which may not completely resolve after discontinuation. But the heart attacks, the blood clots, the diabetes, those are the most significant side effects that both boys and girls will experience from the wrong sex hormones. As I mentioned earlier, young children in the United States and Europe are being sent for these mutilating surgeries, mutilating and sterilizing surgeries. We simply should not be doing this to kids. And this is where we have to take a step back and look at the big picture. Whether we are talking puberty blockers plus wrong sex hormones or so-called bottom surgeries, in other words, hysterectomies in girls and castration and penectomies in boys, what we are talking about here are taking emotionally troubled youth and sterilizing them. That's what we're doing. We are sterilizing them chemically with the puberty blockers and wrong sex hormones, and or sterilizing them surgically. This is horrific. This is not love. We also know from what this chart is showing in adults who undergo sex hormones and surgery, over the long term, they may have an initial emotional relief. It's called like a psychological honeymoon. But by 10 years out, their rates of mental illness and suicide are greater than the general population. And over 30 years, their death rates from, for example, the heart disease, the diabetes, the strokes, these adults who undergo the hormones and surgeries are dying at young ages from the diseases induced by the hormones. They are also still committing suicide. This is a study in Sweden, and when they followed the patients out for 30 years, at the 30-year mark after surgery, the adults who underwent surgery and hormones had a completed suicide rate. So death by suicide was 19 times greater than the suicide rate of the general population. So I ask you, is it loving to offer children and adults who are emotionally struggling with accepting their bodies, is it loving to offer them what amounts to poisonous hormones and mutilating surgeries? as an answer. This slide is simply summarizing a very recent study that found that psychiatric disorders were 7 times higher, their hospitalizations almost 40 times higher, self-harm and suicidal ideation all higher in teenagers who identified as transgender, but those high rates were present before the gender confusion set in. So, in other words, if we really want to help these children, we need to treat the issues that they're struggling with beforehand, the depression, the anxiety, etc., that is coming on before they even have the gender confusion. This slide, a little bit busy, cites 2 studies that gender experts claim. It shows that kids are okay and doing well when their parents affirm them as the opposite sex. A Christian sociologist, Dr. Walter Shum, reanalyzed and reran these studies. And in fact, there was missing data when they were first published. Dr. Shum wrote the authors, obtained the missing data, reran the studies, and came and found the opposite is true, that socially affirming the children caused them to have greater anxiety and greater depression. So the church's position of viewing this gender identity disorder or gender confusion together as a disorder like anorexia or body dysmorphic disorder or body integrity identity disorder, science is in line with this view, and that the compassionate thing to do is to embrace people struggling with transgender belief and help them find the underlying factors to their suffering. Or that should be the job of Christian and ethical counselors and physicians. If we look at what has happened globally, what we are seeing here in this graph, it reflects the rates of gender confusion in boys and girls from as far back as 2009, where it was very low. It was a fraction of a percent. The red line reflects, as you follow the red line all the way over to the right, where it shoots up to 1,400. That is reflecting the number of girls presenting in the UK with gender dysphoria. In less than 10 years, the rate in girls exploded by 4,000%. The rate in boys, which is the blue line, also you see a sharp increase, but not as extreme as in girls. This is what you see with social contagion. This is not a biological, this is not what you see with the biological phenomenon or a genetic cause. Clearly, a rapid increase in gender confusion like this is what you see with social causes. And this is my last slide, also getting toward the influence of the internet. And the vertical blue line is when Facebook came online. The horizontal zigzag lines, the light blue zigzag reflects girls with gender confusion. The dark blue line reflects the boys. So we have a little bit of a bump when Facebook launched. Going further along the horizontal axis, we see the dark the bright green vertical line, that is when Tumblr came online. And we see a spike among girls. The red line reflects when Instagram launched. And here again, you now see the greatest spike among the girls. One theory is that girls, as compared to boys, have always been more sensitive and focused on the appearance of their bodies. And there are many counselors who work with children suffering with gender confusion. And many of the counselors believe that without the push of the transgender civil rights movement, without the presence of transgender material, most of these young women, and maybe even many of the boys, would be presenting with eating disorders alone and not gender confusion. But what this chart clearly shows is that the internet has had a tremendous impact on the increase in incidence. And I will go ahead and stop here.
Thank you, Dr. Cretella. Quite enlightening. We have quite a few questions, but thank you for providing that clarity. With this gender ideology, it's really an ideology, and you've brought forward scientific facts. So I truly appreciate it. And I will give you the first question. Why is this research not more widely shared?
Unfortunately, we have a problem with the cancel culture and censorship. The drugs and the surgeries are very profitable, sadly. So I believe, I'm not the only one who believes this, but those of us who are trying to share the facts believe that big pharma, the business of pharmacology, those forces are very hard to overcome. And in the United States, as well as Europe and Canada, doctors who speak out will often be fired from their jobs, as well as harassed and bullied. Because I work for the American College of Pediatricians, I have a platform to speak. So I receive, I get called names online, but I'm not in the position of doctors who have, who depend on their private practice for their livelihood.
Thank you very much, Dr. Cretella. I understand the cancel culture. It's reaching here now. Another question that we're asking, what should parents do if their child appears to be transgender or gender non-conforming?
Well, I'll even take that just a step back. How about, let me suggest parents who have children who are not struggling yet, an ounce of prevention. I will give some links to Jacqueline that she can share with the audience. But our website has some of them. So you can go to bestforchildren.org, bestforchildren.org. And we do have some parent resources there so that you can educate young children about the truth about their bodies and biology to arm them against the lies. If you have a child who is confused about their gender, we also on our website have a guide to try and help parents interview counselors, so you can find a counselor who will work with your family without pushing the puberty blockers or the wrong sex hormones.
Thank you very much. Bestforchildren.org?
Yes, bestforchildren.org.
Just that the listeners, the participants would hear that. Okay, another question. Should we encourage amputation when a boy or a girl is born with both sexes? I know you said it was not very
Oh,
high occasion. Is it advisable to remove the less dominant ones? Or generally, what should we do, and what kind of advice you can give?
so um, it's not that simple. If there are some, if there's an abnormality that impairs function, then that surgery, the surgery to correct function, should be done sooner than later. So basically, if a child is born with an intersex condition, physicians come together from different specialties, and blood tests, genetic tests are done to try and pinpoint the exact condition that it is. And sometimes surgeries can be delayed, and other times they're completely optional altogether. So the answer is it depends on the specific condition.
Patient. Yes, yes. Understand. Appreciate your response. Okay, so it says getting counseling now seems a bit scary as one doesn't know if the counselor would affirm dysphoria in the child or not.
So many, I don't know the culture exactly in what the situation is like there in the Caribbean. Um, in the States and Canada and Europe, it is very difficult to find counselors who will do the right thing. Parents actually have to interview them over the phone very carefully, and the reason for that is for in the States and in Canada, for example, there are laws that actually ban counselors from saying that change away from transgender belief can happen. Despite these laws, good ethical counselors can treat children without breaking that law and still get at the underlying condition. It just has to be done carefully. And as I said, I'll send a specific link to Jacqueline so that she can email it to everyone. We do have some guidelines on our website.
All right, thank you, Dr. Cretella. Just let any participants know that you haven't registered on Zoom. We have your email addresses. We'll send you the material that Dr. Cretella is promising. Those on YouTube, you're going to have to email the community and we'll send you back a response. But we don't have your addresses, those on to YouTube. Okay, Dr. Cretella, another question. How prevalent are transgender people?
Well, the Diagnostic and Statistical Manual of the American Psychiatric Association had, like, among adults, I believe, was a fraction of a percent, 0.01 to 0.03%. That came out in 2013. More recently, I don't know, because I'm pediatric and I focus on the kids. I do know more recently in the United States, there was a survey of high school students, and up to 2% of high school students identified as transgender or non-binary. And there again, to me and to those of us who realize that children can be helped to embrace and love their bodies, this increase from under a fraction of a percent to 2% of high school students identifying shows the influence of the internet and social encouragement.
Yeah, so we'll talk about the social media afterwards and its encouragement. So another question, Dr. Cretella. If a child, if exhibiting behaviors of the opposite sex, what can be done? Society tend to tell the male boy, for example, stop behaving like a girl. or stop acting gay. How would this be addressed? How should it be addressed?
Right. I think the most important thing as parents is to let our child know, obviously let the boy know we love you. You are a boy. You can reinforce the fact that you are a boy. You have these other interests. I would advise the family. I would say we don't have to condemn those other interests, but we might be able to help the boy, and this goes also for the girl, to expand his interests, to give him some opportunities for success at typical male activities, even if that, I think this is where with boys, interacting with dad is so important. So having a positive father-son relationship, maybe he's not going to go out and be on the school sports team, but if dad can get with his son and a couple of his son's friends, and they play football, on their own, that father-son relationship is key.
Yes. Sorry.
And similarly, you can see the same thing with girls who maybe they tend to be more rough and tumble play, and they want to interact more with boys. You don't have to condemn that. I think it's important to communicate to your daughter that you love her, that she is a girl. She is a girl. And at the same time, find ways to develop a strong mother-daughter relationship. So that way they're not alienated from their same-sex peers, but they can still sort of be themselves, if that makes sense.
Yes, I understand. And I understand clearly, because I'm thinking to myself, if I grew up in this day and age, I would probably have been labeled by my parents as having gender dysphoria, because I was definitely a tomboy in my days. Barbie dolls worked out okay, but tumble and rough, and definitely I maybe have a different result today. So thank God for your information, Dr. Cretella. It's really educating the participants, and hopefully goes a lot further than what's happening in the audience today. You did mention, and I like the anorexia nervosa, because it speaks to the same disorders, and not in a bad way, not in a condemning way. And that's the approach, right, as His Grace had said, and you agreed, that it's all embracing, and we work with the issue. We have a lot more questions, but I guess at the panel discussion. One other comment or question, and we can go further later on. Curvabell's case. Do I have the name correct? The one that you said is happening in England.
Yes.
If you could give me a little more detail, because I feel we'll end the questions on that positive note, because she's had recognition for her case. Am I right?
That is true. She's had international recognition for her case, yes.
Well, if you can share with me, what was her case about? Was it detransitioning that she had a problem, or?
Okay, so yes, but Kira Bell grew up in the UK. She went so in the UK, there is one single gender clinic, the Tavistock Clinic. Because Kira had gender dysphoria as a young teenager, I think in her case, it started around age 13. She went to the clinic at age 16, and very quickly, with almost no evaluation, she was given both the puberty blockers and testosterone. I believe at age 19, she had her double mastectomy. And I believe at age 21, she realized that her emotional distress and her mental illness was not at all helped, and in fact was made worse by the blockers the testosterone, and the removal of her breasts. And she realized, she basically just woke up one day and said, how were doctors allowed to do this to me? How were they allowed to let me as a child believe that me, a girl, a female, now young woman, could ever be changed into a man? And this is just wrong. That was the process that, that was her thinking, this is wrong. And she did not want any other teenager in the UK to be faced with that situation. And in her interviews, she actually says, I don't feel like I'm a woman or a man. I don't know what I am, because at the end of the day, she has a 5 o'clock shadow. Her Adam's apple, and again, this is because of the testosterone, her Adam's apple is enlarged and her voice is permanently changed. So she doesn't sound female. She doesn't really sound male. So that is what, so yes, she did detransition. She stopped taking the testosterone. And most likely she is most likely now sterilized. So she got together with one of the psychiatrists who had resigned from the clinic for the same reasons. There were a number of mental health professionals who also resigned from the Tavistock clinic because they were being forced to give these kids the medications, even though they had, they didn't think it was the best thing. So Cara Bell plus one of the psychiatrists and a mother of another teenager who also went through the clinic, the three of them together filed the lawsuit, but Cara Bell was the lead on the lawsuit.
Wow.
And the judges in the UK listened, and they ruled, because of Kira's experience and the American College of Pediatricians, we provided some of the medical expertise. She had medical experts from Europe and the US backing her experience. The judge ruled, from this point forward, no child under 16 will be given the puberty blockers or the wrong sex hormones. And if they're between 16 and 18, it must be only with a judicial review. It's got to be only extenuating circumstances.